Welcome to the Serra Benefits Group Health Plan Overview. We'll start today with the HAP PPO Gold 2000. This plan has a $2,000 deductible for an individual and $4,000 for a family. It also has 20% co-insurance for an additional $3,500 for an individual and $7,000 for a family, and an annual out-of-pocket max of $7,350 for an individual and $14,700 for a family. Let's set that aside right now. Let's move down to office visit. If you go to the doctor, he's going to charge you a $30 office visit copay. There is telehealth services that are covered 100%. You don't pay a dime. That's through an app called Amwell. HAP is contracted with Amwell to do their telehealth services. When you get registered in Amwell, you go on, you can pick the doctor that's available, have an online office visit with them, either on the phone or on your computer, and then they can call the prescriptions in for you, and it's zero cost to you for the visit. If you need to see a specialist, that's going to cost you $60, and things like chiropractors are $30. Let's go down to prescription drugs. You can see that preferred generic prescription drugs are going to cost you $5 or less for a 30-day supply, and $10 or less for a 90-day supply. What they've done is HAP is allowing you on the drugs that you take on a daily basis to have your doctor rate them for 90 days, which allows you to get 3 months of prescription for 2 copays rather than the 3. This can be a good cost savings for you over the years, so keep that in mind when you're having your doctor write your prescriptions. Non-preferred generic drugs are going to be $15 or less, and then $30 or less for the 90-day supply. Now, 98% of the prescriptions out there have a generic equivalent. So for the most part, you're going to pay $15 or less or $5 or less for your prescription drugs. If it comes into play where you have a non-preferred brand name, those are going to cost you $40 a month. If you have that was for a preferred brand name. If you have a non-preferred brand name, it's $80 a month. We have 2 other categories, and that's the preferred specialty and the non-preferred specialty. These are very rare. The odds on you ever getting prescribed one of these drugs is pretty rare. They're for new experimental drugs, things for conditions that are very rare and just aren't used very often. But if you should come across one of those drugs, they're going to charge you 20% up to a maximum of $200 or 50% up to a maximum of $500. And I know that seems steep, but we're talking about prescriptions that can cost upwards of $50,000 without insurance. So it's nice that they have at least some kind of stopgap there for those. Let's go back up to the top so we can talk about the deductible and coinsurance. So the deductible on the plan is $2,000 for an individual, $4,000 for family. First question is, when does deductible come in? A deductible is going to come in anytime you have an office visit copay, or anytime you have something outside of a normal office visit. So if you go to the doctor and you're coughing and he says, yeah, I'd really like to get an x-ray to see if you've got bronchitis, you're going to pay 100% for that x-ray. And any other services like x-rays, MRIs, surgeries, broken bones, casts, you're going to pay the first $2,000 of those services each year. And it's not per incident, it is a total combined $2,000 over the year. It does say $4,000 for a family, but keep in mind that the way these plans are set up, if one person reaches the $2,000 in the family, that person's done. If any combination reaches $4,000, the whole family's done. But it should be noted that if one person is having a surgery or something, they don't have to pay the full $4,000, they only have to pay the $2,000. After deductible, we have what's called coinsurance. I like to call that cost sharing. And that's where you pay a small portion and the insurance company pays a larger portion. In this case, it's 20%. So you're going to pay 20, they're going to pay 80. So let's say you've used your whole deductible and the doctor wants you to get an x-ray. If that x-ray is $200, you're only going to pay 20%, which would be $40, as opposed to the full price. They're then going to keep track of every time you have to have any coinsurance paid. And at any point, if you paid $3,500 in coinsurance, then your deductible and your coinsurance have been met, and any other service like x-rays, MRIs, surgeries would be free. People get confused because we have this section here called out-of-pocket max, and they think, well, if I have to have a major surgery, is it going to cost me $7,350? No. If you have a major surgery, let's say you have a surgery that's $2,000 or $2 million, you're going to pay the $2,000 deductible, and then 20% of the remainder for $3,500. So a $2 million surgery would cost you $5,500. The out-of-pocket max takes into account anything you've spent in deductible and coinsurance, but it also takes into account office visit copays, prescription drug copays, and any other money you spend towards the plan. If at any point you reach $7,350 out of pocket, everything's free for the rest of the year, and that includes all your prescriptions. Pretty difficult to do on a plan like this, but as we go further, you'll see some plans where that out-of-pocket max is lower. Now, let's just glance over the out-of-network. As I said, the PPO will allow you to seek services outside of the state of Michigan. So if you want to see a specialist at Johns Hopkins or MD Anderson in Texas, you can do that. But you'll see that there is a larger deductible. It goes up by $3,000. And there's 50% coinsurance, and that coinsurance would go all the way to the out-of-pocket max, which would be $20,000. So if you wanted to see a specialist out of state, this allows you to do it, but obviously at a much higher cost. The other thing I wanted to point out was urgent care copays at $65. The reason I point that out is because I mentioned earlier the online visits, and online visits are obviously a lot easier and less expensive, can save you time and money by doing that. Let's move on to our next plan. Our next plan is the HAP PPO Platinum Zero. Now, unlike the other plan, this plan has no deductible and no coinsurance. So if you had a major surgery, you would not pay a dime for the surgery. All you're responsible to pay for on this plan is office visit copays, specialty copays, any of the copays that are listed, and then prescription drug copays. And as you can see, the prescription drug copays are similar to the other plan. $5 or less for the preferred generics, $20 or less for the non-preferred generics. Preferred brand names are going to be 30 or less. Non-preferred brand names are 60 or less. And then the preferred specialty and the non-preferred specialty are 20% up to a max of $200 or $500. So very similar to what we saw in the last plan. When we talk about out of network for this PPO plan, you'll notice that although you have no deductible and coinsurance in network, there is an out of network deductible and coinsurance. So if you seek services outside of the state at a specialties facility, $3,000 for an individual in deductible, and then 50% coinsurance up to $20,000 out of pocket max. So once again, more costly to go out of state, but still able to do it. Let's move on to our PPO plans. Let's start with HMO plans. We're moving on to our HMO plans. Let's start with the HAP HMO Gold 2000. So very similar to the other plan, it has a $2,000 deductible, $4,000 for a family, with that 20% coinsurance up to $3,500 individual and $7,000 family, and then the same annual out-of-pocket max of $7,350 and $14,700. Office visits are still at $30. Televisits are covered 100%, and specialty visits are $60. Now, here's the big difference between a HAP HMO and other HMOs. With the HAP HMO, just like others, you have to tell them who your primary care doctor is. But if you want to see specialists, you do not need to seek a referral. As long as the specialist is in the HAP's HMO network, you can seek services from the specialist without referrals. This is a big plus over other plans out there, and it's a time and money saver because if you have to seek a primary care referral, then you might be paying another $30 office visit on top of everything else. The prescriptions, once again, very similar. We have the $5 for the preferred brand names, $15 for the non, $40 for the preferred brand names, and $80 for the non-preferred brand names. And then the two non-formularies, the preferred specialty and the non-preferred specialty at the same 20 and 50%. As you can see, No out-of-network services, so you can't go to a specialist outside of the state of Michigan. But if you're on vacation or you're out of the state of Michigan, you can seek services at an after-hours clinic or an ER, and it will be covered under your network insurance. So no fears if you're on vacation and you get sick, just seek out an urgent care or an after-hours, or you can use the telehealth visit as well for those services. Let's move on to our last plan, which is the HMO Platinum Zero plan. Just like the PPO plan, it has a zero deductible, zero co-insurance, and a $1,500 out-of-pocket max. So $2 million surgery is going to cost you nothing. All you're going to pay for is your office visit copays and your prescription drug copays, which office visits are 20, prescription drug copays are the 5, 20, 30, 60, and then the 20% and the 50%. So all you're going to pay for on this plan are any of the copays that you can see, ER copays, urgent care copays, and prescription drug copays. But it has a $1,500 out-of-pocket max. And this is something I point out. If you have a member of the family that's on a lot of prescriptions, you know that those prescription drug copays can add up quickly, and you could be spending $100, $200, sometimes $300 a month in just copays. Well, a plan like this might be the way to go because once you've spent $1,500, then the rest of the year, all your prescriptions are free. So something to think about. And if you want, you're more than welcome to call us at 810-584-7458. That number is listed on the top of your employee navigator page. Uh, and I'm extension 1. We are available 24/7. So it doesn't matter what time of the day or night. If you call that number and push extension 1, we're here to help you and answer questions. That is the end of our presentation for the health plans. If you still have questions, feel free to call the number. We're here to help and answer questions. Thank you.